Well, should we start, Melody?
I am ready.
Yeah. Well, thank you everybody for being here. My name is Claire and I'm the founder of StudentRDH. I apologize. I had to take this call in my car just because I was running between meetings. But I'm so glad you're all here because we're going to talk about anxiety related to local anesthesia, right? I mean, how many people have anxiety right now because you are in class or you know you're going to give injections or because you know it's going to happen sometime in the future? You can put
Mm.
that on the chat. So I just wanted to, oh, we have a first injection this Friday. Wow.
First injection. Oh,
That,
Michaela. Wonderful. First
yeah,
injection.
great. So I just wanted to quickly introduce to you the other Claire. No, her name is Melody. Sorry, it says Claire on the screen. It's just our Zoom, how it's labeled. So Melody is part of our team. Sometimes you might receive emails from her. And Melody started to join us pretty recently this year because we needed a lot of support for our students and schools. And Melody's awesome because first of all, well, she used to be a teacher. She used to be, so she is still in Arizona, and she used to teach at the Fortis University over there at the program in dental hygiene. And she used to know what it is like to give injections. She used to teach that. So she knows exactly, you know, what to share with you today. And also just a little bit about her. She lives in Arizona and she has her bachelor's degree from Northern Arizona University in biology. Am I correct? And
In
then,
biology, yes.
yeah. And continued her journey in dental hygiene in the same school. So she's a pro in science and also a pro in dental hygiene, a pro at teaching. So today is actually Melody who is going to share all her expertise in how to just really ace your game in the clinical setting with local anesthesia. So I'm going to pass this on to Melody. Thank you.
Thank you, Claire, for your kind introduction. All right, so today we're going to be talking about tips to help manage anxiety from a clinician's viewpoint. So as hygienists, we experience patients who are nervous pretty much on the daily basis. But what I want to focus on is when we start to feel nervous, you know, right before we give an injection, or if we have a competency in clinic coming up, if we have an exam. So I'd like to give you some tips that maybe that you can try when you're chairside to help calm your nerves. Okay, so this is a picture of basically how I felt during hygiene school. I chose the topic of anxiety because when it was time for me to give my first injection, and even after multiple injections, I still felt that I would become very shaky. My heart would race. I would have all these thoughts coming into my mind right before I give an injection. And what would happen is I would feel that I would start to lose control. So I don't know if any of you have kind of felt like that in hygiene school, whether it's getting ready to give an injection or again, making or having your instructor watch you in clinic as you do a skill eval or a competency. But I felt like I couldn't focus on the present moment. And so what would happen is that, you know, I would get so worked up inside. You could see it on the outside too with my hands shaking that I felt like it really started to affect my self-esteem. And then as a result, I would become even more anxious. So it can be a cycle that can be very difficult to break when we have all these thoughts swirling around where there's physical changes that goes on into our body during times of stress. But I'm here today to help you kind of break that cycle with different things that we can try before leading up to an injection. And also when we're sitting chair side, when our patient is in the chair to kind of help calm that jitters. So I know looking at the chat right now, I see some of you are probably in anesthesia right now. So let me know if you're getting ready to do some injections in clinic. probably on each other right now. Or maybe you're a clinician who's been practicing for a couple years now, but you're still feeling like you experience some jitters, some stress, some nerves right before you're giving an injection. All right, so you're starting, I'm looking at the comments here. So some of you can identify with this picture, right? We're always feeling like this. We get kind of worked up. I see people are doing mandibular injections this Friday, so your IAs, right? A lot's going on, and it's a very exciting time. Being able to master injections, it really helps to instill trust in our patient that we can treat them and provide therapy in a comfortable manner. So that's my goal here today, to help you feel a little bit more calm and feel like you're ready to go out there and give injections, or go out there and do those competencies, take your board exams. So let's go ahead and get started. So objectives. So today we're going to go ahead and talk about the stress response. So what takes place in our body, maybe when we're in situations that make us feel uncomfortable or unfamiliar, right? So maybe the first time that you give an injections, maybe it's the 50th time that you give an injection, but you're still feeling that stress response take place in your body. So we'll talk about the autonomic nervous system. So we'll review the activation of the sympathetic nervous system, the physical changes that take place, right? Our heart rate starts to increase, our breathing rate as well starts to increase, and we'll also talk about the emotional response that comes along with that. I'll also be breaking down and analyzing some of the what ifs. So these are thoughts that can come into our mind right before we give give an injection, that can really heighten our response to these certain situations. We'll also talk about anxiety management techniques, right, that you can do chair side to help calm your nerves and bring you back down to the present moment. So we'll be talking about diaphragmatic breathing, or breathing from your belly. Some of you may have heard about this before. And we'll also practice this techniques with the box breathing technique. We're going to talk about grounding techniques as well, to help us regain focus when we're feeling a bit on edge. So the two techniques that I'll be discussing today, the first one will be the 5-4-3-2-1 method, and also body awareness. Lastly, I'll help you build confidence in your abilities by exploring our inner dialogue. So when we are faced in a stressful situation, we'll be able to analyze, what do you hear? Are you hearing positive thoughts? Are you hearing thoughts that may be a little bit more negative, untrue? And I'll go through an exercise where we can use positive coping statements, again, to help replace some of those negative thoughts or feelings that we may have. And really my goal here today is to give you some tools that you can use in your toolbox. Again, when you're starting to feel a bit anxious, maybe you can feel like your hands are starting to shake, your heart rate is racing. So things that you can try to help calm your nerves. And also these are things that we can help with our patients. So when we do encounter patients that are also nervous prior to an injection, we can also use these techniques with them as well. So briefly, just a little bit about me. So again, my name is Melody. I was born and raised in the Valley of the Sun in Phoenix, Arizona. I've lived here my whole life. I love warm temperatures. I love the sunshine. Is anyone here from Arizona or has been to Arizona? Looking at the chat. So I did go to school for my college studies at Northern Arizona University. So there's a picture up here. Yes, it does snow in Arizona. You can see that there is snow on the ground, the sign for NAU, Go Lumberjacks. So like Claire mentioned, I did receive my bachelor's degree in biology and in dental hygiene. After I graduated, I did work in both public health and private practice. But as soon as I graduated, I always knew that education was an avenue that I wanted to explore. So after I got a few years of experience under my belt, I took a leap of faith and I applied for a position at Fortis College here in Phoenix, Arizona. And thankfully, I was able to get the job. I started 2 days a week as an adjunct instructor, working primarily in the clinic. So I would work with students of all levels. So, all the way from pre-clinic to all the way with the seniors. Eventually, I transitioned into a full-time position. And most recently, I was the lead clinical instructor for the seniors. So I'm very thankful for my time with Fortis. I was there for 4 years. And as a result, again, I was able to teach pre-clinic in the classroom, community oral health, which is another topic that I'm passionate on, and career development. So as an educator, I would work very closely with students, and I would help them kind of get over some of the nerves that they're experiencing, especially in pre-clinic when everything is new, and you have people starting right out from the very beginning washing your hands. So even something that we've been doing for years and years and years, it was cause our students to become, anxious. This is the first time people are actually watching you do a skill. And so I would work with students and would often come up with situations and solutions together. And so some of these solutions I'd like to share with you about how to calm our nerves. And then most recently, back in June of this year, I joined the StudentRDH team. And it's been an amazing experience because now I can interact with students and dental hygiene educators from across the United States. So not just in Arizona, but now I can talk to students from New York, talk to students from Florida. So it's been an incredible experience. Okay, so now let's go ahead and talk about anxiety. So anxiety, if you were to just type that up into Google, you would probably see that there are many different definitions that you can find. Anxiety.org defines anxiety as the mind and body's reaction to a stressful, dangerous, unfamiliar situations. And what I want to stress here is anxiety is a normal response, and it can be a very helpful response if, again, we are truly in a dangerous situation. So if we were open the door and we see a T-Rex here, right, our bodies would be able to respond immediately to keep us safe. You can also think about it if you are driving in a car in the rain. You may start to slow the vehicle down. Again, scan the road just to make sure that you're safe. So anxiety is not always a bad thing, but sometimes it can be definitely kind of hard to control some emotions and some of the effects that go along with it if we are in unfamiliar situations. So I'm going to actually be turning my camera off just to help with the flow of the slides. I will still be looking at the chat too to interact with you, but if you're wondering where I go, so I'm just going to stop my video and we'll go ahead and move forward. Okay, so let's go ahead and talk about perceived threats. So again, our body does a tremendous job reacting to situations that are dangerous. So again, if we were hiking and we saw a rattlesnake on the trail, right, we would, respond immediately by getting out of that situation. But sometimes our response can work a little too well, and we can react to things that are not true life-threatening situations. So just looking at a needle or a dental syringe when we're in clinic can be very triggering, not only to our patients, but also to us as a clinician. So again, this is a perceived threat. And in our minds, that needle may seem like its biggest threat as the rattlesnake pictured on the screen, which is something that is truly dangerous. So think about it. When we deliver anesthetic to our patients, we do the best to keep the syringe out of the view of the patient's eyes, right? We kind of bring it down around the chair to, again, not let the patient see it. And why is this? Because needles can be associated with discomfort with fear. So sometimes as a clinician, when we are first starting to administer anesthesia, just looking at a needle can trigger some responses with us. And I don't think that that's talked enough. Maybe that we have also experienced some unpleasant situations in the past, maybe as children going to the dentist. So again, just by looking at things, we can have a stress response. And as clinicians, not only do we have to look at the needle, but now we have to uncap the needle, we have to screw it on our syringe and actually go in and perform an injection. So that's a lot that we have to process and get comfortable with right from the beginning. So let's talk about the stress response that takes place in our body. So the stress response. So if we were to encounter something that may be a perceived threat, so again, if we just look at the needle, sometimes signals are sent from our eyes to an area in the brain called the amygdala. So this area in the brain contributes to emotional processing. It can also respond to different memories that we might have, different emotions, and especially to fear. So this area, the amygdala, it interprets the image, and then if it really feels like there's a threat, it sends a distress signal, like almost like an alarm, to the hypothalamus. So you can think of the hypothalamus as the command center in our brain, and it communicates with the rest of the body through the autonomic nervous system. So the autonomic nervous system, and this is just a brief review, this is the nervous system that controls involuntary body functions, right? Things that we don't have to think about, like our breathing, our blood pressure, our heart rate. We don't have to think about our heart beating. It just beats. So there's two components of the autonomic nervous system. We have the sympathetic nervous system and the parasympathetic nervous system. And most organs in the body are innervated by neurons from both systems, and they have opposing effects on the body. So during times of stress, the hypothalamus activates the sympathetic nervous system, so our fight or flight response, by sending nerve and hormone signals to different effector tissues or different parts of our body. You can think like cardiac muscle, and it initiates a response. So just to review from your pharmacology course, the preganglionic neurotransmitter in the sympathetic nervous system is acetylcholine, and the postganglionic nervous system is norepinephrine. Now you see a picture on the screen here of our kidneys. So our kidneys also play an important role in the stress response. So on top of our kidney, we have our adrenal glands. And inside the adrenal gland is the adrenal medulla. This responds to the acetylcholine, the neurotransmitter, that is sent through the nervous system. And in response, it pumps out hormones like epinephrine and norepinephrine into the bloodstream. We also have the outer component of the adrenal gland, which is the adrenal cortex. So the adrenal cortex produces and releases cortisol, which is, you can usually think about that as this hormone that's associated with stress. And cortisol helps to raise the amount of glucose in our bloodstream because it's preparing us to either fight or flee. So the fight or flight response. So again, when the nerve and the hormone signals are produced and sent throughout the body, we can have physical responses that start to happen. So with our breathing, our breaths can become rapid and shallow. We could start to sweat. Our heart rate also increases. Our muscles can feel really tense, and our hands might begin to shake. So those are the physical responses that tend to take place, but let's talk about the emotional response as well. So our thoughts alone can trigger a stress response in the body, even if we're not in a life or death situation. So we don't need to see anything with our eyes. We can just think of certain thoughts, and then all of a sudden, we start to notice these physical changes start to happen. And I'm sure this has probably happened to you before when you're lying in bed and you're trying to go to sleep, and then all of a sudden something comes in your mind. Maybe you're thinking about what's going to happen in clinic the next day, and all of a sudden your heart rate starts to increase, and there's this cascade of changes that start to take place in our body just from our thoughts alone. So our minds are very complex, and sometimes it's really hard to stop certain feelings from coming to the surface and kind of triggering this response. So it can feel like we're always on, that our nervous system is always activated from the sympathetic response. So often before we perform a new skill, like giving an injection, we start to think about all of the what ifs. What if this happens? What if that happens? And we just think, and our minds start racing. And when this happens, these what ifs, they start taking us out of the present moment, and we start thinking of all the things that can happen in the future. And these are things that are typically, what we associate with bad things, like, oh my gosh, worst case scenario. What if we do this? What if we do that? And these feelings can be so strong and so overwhelming that they can result in us avoiding situations where we would have to face some of these feelings. So I've seen this with students after they have passed their anesthesia class, they're in clinic. Maybe they don't quite feel comfortable giving injections just yet. They're still working on it. And I know me in my early days of private practice too, there was certain injections that I'd feel more comfortable giving than others. So there are certain situations that maybe I would reach for lidocaine or another topical anesthetic instead of doing an injection. However, it's important to realize that avoidance really fuels the feelings of anxiety. So worry, fear, the feeling that we're starting to lose control. And eventually we won't be able to avoid every situation that calls for us to have to anesthetize our patient. Lidocaine, I think it's very effective for localized areas to help with pain management when we're doing our scaling. However, there's going to be times when patients absolutely need to be anesthetized for us to provide the highest level of care. So it's best if we can address some of these what if statements. So again, you feel more comfortable delivering an anesthetic and you don't avoid not doing it. So let's explore the what ifs. So when our mind starts to be filled with these feelings, it's beneficial to maybe write them down so we can identify the source of what is making you nervous. So what are the what ifs? Once we identify what the source is, we can break them down and analyze these thoughts to help develop a plan or a solution about how to handle certain things that might come up when we're delivering anesthetic. So let's look at a few examples. So the first one we'll look at, what if? What if the needle comes out the side of my patient's face and anesthetic solution shoots out like a geyser? Okay, what if? Oh, just seeing this picture, you can probably get a mental image of that needle coming out of the patient's face and just squirting anesthetic solution all over the place. And I can tell you that when I was back in school, and this was about 10, 11 years ago in anesthesia, this was one of my class's biggest fears. It caused us to be very anxious about practicing certain injections like the ASA, the IO, because we had this mental image that was so strong in our head, and we just kept thinking about, what if this happens? What if this happens? Well, let's address this. It's important to realize that, in times of stress, our minds usually go to the worst case scenario. What if this happens? And in all my time delivering anesthetic, I can tell you that the needle puncturing outside of my patient's face has never happened. I'm not going to say that it's not possible. If anything, the year 2020 has taught us that anything is possible. But again, this is usually like worst case scenario. And I've watched countless amount of students give so many injections over and over again, and I've never seen this happen. Okay, so again, worst case scenario, but it's important when we start thinking about the what ifs, especially like things like, what if the needle does this, what if this happens? Just note that safety is our #1 priority when delivering anesthetic, and we usually do things step by step in a manner to ensure safety, not only for you as a clinician, but for your patients. So you may recognize these steps that are on the screen here. You probably will be saying them out loud when you start delivering anesthetic in your in the clinic during anesthesia lab, or when you're treating patients. But sometimes it can really help calm our minds just by taking things one step at a time. So for example, if you are going to be giving the MSA, your first step would be to identify the site of penetration, right? So you can think to yourself, okay, I'm going to look over my material. I'm going to look over my Malamed book or my Bassett textbook, my PowerPoint slides from lecture, and I know that for my penetration site, it's going to be the height of the mucobuccal fold above the second molar. So when you're in lab and your instructor is supervising you, you know exactly where to place the needle for your minimum penetration. And then what do? We say this out loud. Minimum penetration, and your instructor will usually say something along the lines of, I see, proceed. So then we can take the next step, right? At angle, at depth. So I know that for the MSA, I need to go about 5 to 8 millimeters of the needle directed 20 degrees medially. Once I'm at my depth, I say at depth and angle, your instructor, I see, proceed. Next, aspirations, aspiration, pause, negative. Your instructor, I see, proceed. And again, we're going step by step. So that can really help calm your nerves, so you'll know exactly, what the material that you're going to be to look over. And we use the same steps when we're in private practice too, in delivering anesthetic to our patients. Now, we might not say every single step out loud. When I do anesthesia, when I'm treating patients, I don't say, minimum penetration, but I still think through these steps in my mind, again, to make sure that I'm hitting the right landmark so I can have a successful injection. So the next what if? What if my patient knows that I'm nervous? Again, so we feel like our facial expressions will be like the clinician on the left. And as a result, our patients might respond like this, wide-eyed. They might feel like, oh my gosh, I'm going to get an injection. Ah! So how can we approach this? So just remember that you're in a school setting, and in my experience, patients are very understanding. They know that you're there to learn. Also, as a hygiene student, right, we practice on each other first, and that can really help kind of calm their nerves because, everybody's experiencing the same thing at the same time. So that can also help us feel a little bit more confident because we're starting on each other, and then we're going to be moving on to, treating patients in the clinic. Also, it's very unique in hygiene school that we have the opportunity to see family members. So maybe you see your parents, grandparents, friends, significant others, and these people are here to support you, and they want to see you succeed. And maybe your patient is nervous. Chances are they may experience some nerves before giving an injection. It doesn't matter who's giving it. It may have nothing to do with you. But just they're feeling, again, perceived threat. When we encounter a needle, right, we think that it's associated with discomfort and fear. But this is a great opportunity for you to talk to your patient and to find out exactly what they're experiencing. So maybe, again, they had a past experience where they had dental work done, maybe they weren't all the way numb, and it gives them anxiety to think about getting injections and having work done. But this is a good idea, or we can use this to really strengthen our rapport with our patients, talk about what they experienced in the past, and then it also is a way for us to use stress management techniques like some that we've talked about today on both your patient and yourself to make you both feel at ease. And of course, the more you practice, the more your confidence will grow. Okay, so the next what if? What if I shake so bad and my classmates see? I will feel so embarrassed. Does anybody have this thought? I know I did. I was constantly comparing myself to my other classmates. I was worried that they would be judging me. If I do get nervous and I do shake, what would they think? And again, I just want to stress that we are all on the same journey. We all have the same goals in mind. And it's really important to be kind and supportive to each other at school. Because again, we don't know what's going on internally with other challenges that people may be experiencing. But we are all climbing that same mountain and to reach the top. And we're going to be talking about today different things that you can do to help calm when your hands are shaky. But I just want to encourage you to be kind and to don't make fun of people because they're having this physical response to stressful situations. Also in hygiene, or excuse me, in your anesthesia course, I'm sure you'll be covering different fulcruming positions, different hand supports that you can use. So definitely practice those, and those can make you just feel more supported when you're holding the syringe, and again, can help with shaky hands. Okay, and the last what if. So this is the biggie. This goes out to all you students out there who may be taking their mock board exam in the fall. Maybe you take your actual clinical mock exam in the fall. I know when I was a student, I took mine, I believe in November. So, right around the corner. And the last what if statement is, what if I fail? So just looking at this statement here, it might trigger a response to you. What if you fail? As a dental hygiene student, we place an enormous amount of pressure on ourselves to be perfect all the time. That's kind of our personality as hygienists. And when things don't go according to plan, it can be absolutely devastating. And it's okay to feel sad if that happens. You may cry, and that's okay. Just know that you can and you will overcome this. Keep in mind that, although you may have hit a bump on the road, you're still on the right path to reach the top of the mountain. And, I encourage you to ask for feedback from instructors, and you'll know exactly what to do the next time that you perform an injection. And most importantly, just remember why you started. So why did you choose dental hygiene as a profession? Is it because you're passionate about educating your patients on the oral systemic link? Do you want to develop lifelong relationships with patients? Do you want to help patients feel more confident about your smile? So if you happen to fail a skill eval, a competency, your mock board, your board exam, that does not define you as a dental hygiene student. You can overcome failure and be an exceptional hygienist. So those are some of the what ifs statements that we tend to hear before giving anesthesia, and you might think about those, a week before you give an injection. You might think about it a couple days before giving an injection, 5 minutes before. Now we're going to change gears, and we're going to talk about certain things that you can do chairside when you're feeling anxious, and that fight or flight response is starting to fire. All right, so the first one, and I'm sure everybody has heard this, right? Just breathe. This is something that I've told myself, or I have been told when I'm feeling stressed or anxious, right? People will tell me, oh, just breathe, Melody, just breathe. You'll be fine. Just breathe, just breathe. But as we talked about earlier, when our sympathetic nervous system is activated, your breaths become more rapid, more shallow. So hearing just breathe may actually cause your breathing to increase even more, and soon you're on the verge of hyperventilating. So instead of just repeating, just breathe, just breathe, just breathe, over and over in your minds until you're practically screaming at yourself, because this is what would happen with me, I suggest that we approach this in a different manner. And we can do this by thinking about our breath as an anchor. So breath as an anchor. So I'd like to share a metaphor with you that has really spoken to me, as since I have a tendency to worry about everything that could go wrong in certain situations. And I tend to have lots of thoughts kind of swirling around in my head at one time. So the metaphor is, When you are lost in the sea of your mind, the breath becomes an anchor to return home to shore. So you can use your breath as an anchor to return to the present moment. So in moments of stress, when you're feeling anxious, your breath is always there and you can return to it at any moment. And the best part is there's no equipment needed. So to use your breath as an anchor to bring you back to the present moment, let's breathe from our bellies. So we're going to talk about diaphragmatic breathing, right? Really engaging our diaphragm so we can breathe more deeply and more controlled breaths. This form of breathing really focuses on the quality of breath, right? So again, we're trying to slow down that breath rate, trying to breathe deeply instead of those shallow breaths that are from our chests. So let's talk about the role that your diaphragm plays in breathing. So your diaphragm is basically a dome-shaped muscle on the base of your lungs, and it's one of the most effective muscles that we use when we breathe. So when you inhale, your diaphragm contracts or tightens and moves downward. This creates more space in your chest cavity and allows your lungs to expand. When you exhale, the opposite happens. Your diaphragm relaxes and moves upward in the chest cavity. So by really activating our diaphragm, this encourages full oxygen exchange with the blood and our lungs, which tend to decrease the work needed for breathing and helps to slow down your breath rate or your respiration rate. It decreases the oxygen demand, and then it requires less effort and less energy to breathe. So how does this affect our nervous system? Well, research has indicated or suggests that when we breathe deeply, like doing our diaphragmatic breathing from our belly, it may help to stimulate the vagus nerve. So the vagus nerve is the 10th cranial nerve, and it plays an important role in the parasympathetic nervous system. It's estimated that 75% of all parasympathetic nerve fibers in the body come from this nerve, and it's the main supplies the main parasympathetic innervation to the heart. And again, when it's activated, it can help stimulate a reduction in the heart rate. So again, just by breathing in our belly, we can trigger our parasympathetic nervous system, which we think rests and digests, and it can help bring us down into a more relaxed state by reducing our heart rate. It helps to stabilize our blood pressure as well, and kind of can help us feel a little less tense. So now let's go ahead and reset your breath with a technique called box breathing. This is a belly breathing exercise where you visualize inhaling and exhaling as you move around 4 corners of a square. And this technique is very simple to do, and you can do it practically anywhere. You can do it while you're sitting chairside, when you're in the car, if you're stuck in traffic and you're feeling a little tense. So it's great, it's easy to do, and we'll go ahead and practice. So I'll just describe what belly breathing is, and then we can all practice together. So again, you're going to visualize a square, the 4 sides of a square, and if it's easier for you, while you're in clinic, if you have a piece of paper nearby and you can just draw a square and tape it up in your op, so you have something to look at. So sometimes we need that visual clue as well. Definitely, I recommend that. So when you start with box breathing, you can start at any corner of the square, and you're going to basically breathe in for 4 counts as you trace the first side of the square. Next, you're going to hold your breath for 4 counts as you trace the second side of the square. Next, you're going to breathe out for 4 counts as you trace the third side of the square. And then lastly, you're going to hold your breath for 4 counts as you trace the final side of the square. So once you complete all 4 sides, you've just completed 1 deep breath. So let's go ahead, we can practice. So if you want to go ahead and practice, I'll count down. So you can pick any corner if you'd like on that square. So let's go ahead and inhale. So inhale, 1, 2, 3, 4. Hold your breath, 1, 2, 3, 4. Now slowly exhale, 1, 2, 3, 4. And hold your breath, 1, 2, 3, 4. Now, when I first started using this technique, it was very difficult for me to hold my breath for 4 counts. I don't know if any of you experience that while we practice. Like, I can't do that. That's just way too long. That's okay. You can go down to 3 seconds or 3 counts. It doesn't have to be 4. As you get more practice and you go through this exercise a few more times, maybe you'll be able to increase the count up to 4. So that's one technique that you can do to help stimulate the vagus nerve and our parasympathetic nervous system. Again, is to visualize breathing, inhaling and exhaling as you trace around the sides of a square. Hey, we're also going to be talking about different grounding techniques. So grounding is a practice that can help pull you away from unwanted memories and negative or challenging emotions. So there's going to be 2 techniques that we'll go over. And again, they're helpful to help you refocus your thoughts and your attention to what is going on in the present moment. So we'll first talk about the 5, 4, 3, 2, 1 method, and then we'll talk about body awareness. So the 5, 4, 3, 2, 1 technique, this technique helps to bring you back in the present moment by purposely taking in details of your surrounding using each of your 5 senses. So it really encourages you to notice the small details that may be around you that sometimes our mind has a tendency to just pass over when we're feeling stressed and nervous. So let's explore. So starting with sight. So what are 5 things that you can see just around you right now? And I want to challenge you to look for the small details instead of just saying, well, I see a computer, I see a watermelon, I see a water bottle, I see a pen, and I see a toy. So really look at the finer details. So if you have a rug, look at the pattern of the rug. If there's light shining in from a window, look at the different patterns the light can make on the floor, or look at the different shadows. So the things, again, that we would typically just tend to overlook when we're feeling nervous. So next, we're going to be looking at 4 things that you can feel. So maybe you notice the sensation of the clothing on your body. Maybe you can notice how your chair is, how you feel in your chair. Is it supporting your back? You can also pick up an object. So if you're in clinic, you can reach for your mirror and just feel the weight of the mirror in your hand. Notice the texture on the handle. So again, just looking around and feeling certain sensations. The next, what are 3 things that you can hear? So pay attention to sounds that your mind has turned off. So for example, if you're sitting right here in this moment, if you pause, what can you hear? Can you hear the sound of maybe traffic in the distance? Or maybe you can hear an airplane flying above in the sky. If you're in a room with a fan, you can hear the hum of a fan. Right now in Arizona, it's actually cloudy and a little bit windy. So if I concentrate hard enough, I can actually hear my wind chimes outside. The next sense that we'll explore are what are 2 things that you can smell? So try to notice the smells around you. For example, I know it's the afternoon where most of you are at if you're in the East Coast. So maybe before this webinar, you heated up your lunch in the microwave. So, take in a breath and see maybe you can smell, the smell of reheated spaghetti. Or if you're here in my house right now, if I breathe in deeply, I can smell a pumpkin waffle that I had for breakfast. So again, just pay attention to what's going on around you, and that'll help you return to the task at hand. And lastly, our last sense that we'll talk about is our favorite, our sense of taste. So what is one thing that you can taste? So usually before clinic, before we start seeing our patients, we reach for our toothbrush and our toothpaste, we give our teeth a brush, we might use some mouth rinse, making sure that everything is nice and minty. So right now, what are things that you can taste? So maybe you just brush your teeth, or if you're like me, this fall is my favorite time of year. It's when candy corn and mellow cream pumpkins start returning to the store. So maybe you were like me and you just ate a handful of candy corn before starting this webinar. So let me know if anybody else loves candy corn as much as I do. And if you don't, that's totally fine. I know it's not for everybody, but again, you just want to kind of pinpoint in your mouth something that you can taste. Okay, so our last grounding technique is called body awareness. So body awareness is a technique that you can do to help bring you in the here and now by directing your focus on different sensations in your body. So for example, right now, if you were to put your feet flat on the ground, right, just spend a few moments kind of wiggling your toes and maybe curl and curl them. Maybe you're wearing your favorite pair of socks and you can pay attention to the sensations that brings to you. So maybe your feet are feeling nice and warm and toasty. Again, just kind of focusing on a different part of our body and noticing those sensations that take place. So I'm looking through the comments. Lucy, I agree with you. Candy corn is the best. Jennifer, candy corn and peanuts. Yes, yes, definitely. Gianna, you're eating candy corn right now. Love it. Okay, so another body awareness technique that we can do when we're starting to feel like our hands are really shaky is to just spend, 15 seconds to give yourself a hand massage. I know a lot of you right now in clinic, you may be doing a lot of hand scaling if you're not able to use your ultrasonic instruments because everything that's going on with the pandemic. So when we hand scale a lot, what happens, our muscles in our hands tend to become very tense, very tight. So just by putting a slight pressure on different pressure points in our body, like on our hands and our palms, it can aid in stress reduction. So to give yourself a 15-second hand massage, what you can do, if you have your palm facing up on your hand, you can place your opposite thumb in the area of your palm between your thumb and the index and your index finger. And then use a circular motion and massage the spot for 15 seconds. And then switch hands and repeat as many times as you like. But for me, especially when my hands are really tense or shaky, again, this can just cause certain sensations in my body. I think it feels good and it can help, again, kind of release some of that tension in our hands. So the last tip that we'll talk about today is really looking at our inner dialogue. So take a moment and really listen to the thoughts that are going on in your mind when you're faced with a stressful situation. So what do you hear? Are your thoughts filled with self-doubt or words of encouragement? So again, what do you hear? So right before an injection, this is very, very common. Our minds can be filled with negative and untrue thoughts, and they tend to take over our minds when we're starting to feel stressed or anxious. So how many of you have heard this before? I know I've said these things to myself in the past. I'm the worst student ever. I am going to fail. I can't do this. 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 I should just quit now. Right? Just thinking about this, how does that make you feel? Pretty defeated. And it's really important to remember that when these thoughts come into our mind, that they're most likely untrue. They're negative thoughts, but they can definitely have an impact on us. So what we can do to help replace these thoughts, if this is typically what comes to your mind first, is by using positive coping statements. So positive coping statements, these are positive, truthful statements we can use to replace the negative and often untrue thoughts that come to our mind when we're dealing with stress. They can really help us build confidence in ourselves, and they can be very empowering. So let's do this again. Here are some examples. So what do you hear? I am a well-prepared student. Right, true. I've looked over my material. I've read my chapters in my textbook. I am well prepared. This injection will be over in a matter of minutes, so you can tell yourself this. It really does put things in perspective. Sometimes we get so stressed out about performing an IA or performing an injection on the palate that it's important to keep in mind that really this will be over in a matter of minutes, like maybe 2 minutes. These are very quick. I can and I will do this. I am capable of treating my patient safely and comfortably, and I can continue to breathe deeply, right? So we can say this to ourselves quietly. So while you're sitting next to your patient, you can repeat some of these things, again, to help calm your nerves. As you probably can feel a difference from when the first statements that we read, I can't do this, I can't do this, I'm going to fail. To these statements are positive coping statements. I can and I will do this. I am capable. So tips for writing positive coping statements. So oftentimes when we feel overwhelmed, it can be difficult to remember what your statements are. So what I suggest is maybe to write them down, maybe make a separate note in your phone or on a piece of paper, and then carry them with you. So if you experience a stressful situation, or if you know something is about to take place, like I'm about to give my first injection, you can pull these out quickly and just, start kind of saying these in your mind before it's time to actually give that injection. You want to also write them in your own words. So what's helpful for me, my nickname is Mel. A lot of people, friends and family call me Mel. So when I write my statements, I say, Mel, you can do this. So write them in a way that you would feel comfortable just speaking to yourself. They don't need to be long, so just go ahead and keep them very specific to what you're about to face. So again, with injections, I'm going to continue to breathe deeply before I give this IA injection. And also to keep them, again, you don't have to write many sentences down. They don't need to be a paragraph. Just keep them brief, just keep them simple. And to recap, so there are many different factors that can contribute to making us feel nervous before giving anesthesia, right? We talked about sometimes just seeing that needle or thinking about the what ifs can trigger our flight or fight responses that take place in the body. So what we can do if we're starting to feel really nervous is to write down some of our thoughts so we can kind of analyze and pick them apart. Maybe we can share our thoughts with our fellow classmates and kind of see if they're feeling the same thing, because chances are, that you probably are feeling nervous as well. Or with your instructors, they can give you valuable feedback and advice that you can do to kind of help calm these fears. We talked about looking at our breath as an anchor. And so when you feel like your breathing is starting to increase and your heart is about to race, you can use your breath as an anchor to return to the present moment. And we can do this by practicing belly breathing. And we can reset our breath or reset our breathing pattern with different breathing techniques. So you can go to the box breathing technique if that's helpful to return to the more relaxed state that our parasympathetic nervous system can have on our body. There's also different grounding techniques, like the 5-4-3-2-1 method or body awareness techniques that can aid in refocusing our attention to the tasks at hand. So take a moment to notice the sights, the sounds, the sensation around us that we tend to overlook in times of stress. Or maybe just take 15 seconds to give yourself a quick hand massage. Notice the sensations that happen when we start kind of rubbing out some of those tense muscles in our hands. Also use positive coping statements to reduce, or excuse me, to replace the negative, untrue statements, which can again help build our confidence and our ability to perform a successful injection. So these techniques, they can be used quickly and easily in many different situations and different settings, both in and outside of the operatory. So, go through, maybe practice a few of these, have them in your toolbox ready to go before you do your first injection or before you do your 100th injection, and you might feel those nerves to kick in. So I just want to say thank you so much for everyone for being with me this afternoon. I'll leave my contact information here on the screen. Again, my name is Melody Wright. I'll turn my camera back here. This is my email address if you ever want to contact me, melody.wright@studentrdh.com. I would love to know how your anesthesia course is going. If you get through that first injection, I know one of you were saying that you were going to have your first injection on Friday. It's such an exciting time. I know it can be nerve-wracking as well, but just think about how good you'll feel when that injection is over and we're able to scale our patients and provide periodontal therapy safely and comfortably. So thank you, everybody. If you have any questions, please let me know. I'm just going to read through some of the responses on the chat from Carly. Oh, this is really good. So what Carly said is that when she's telling herself that when I'm feeling nervous, the emotion is actually excitement, and it can help me get through a lot of new things that I wasn't easy about. So thank you for sharing. That is a wonderful, wonderful idea. So instead of feeling really nervous, these are exciting moments, as it really is. You're learning a new skill, and you're going to master that skill. Which is very important in the field of dental hygiene, is being able to anesthetize our patients. It's definitely can be helpful, when we're out in private practice, maybe searching for a job. A lot of postings, they specifically will ask if you live in a state that, hygienists are able to administer that. They want you to be certified. So yeah, thank you so much, Harley. That was amazing. And I hope everybody has a great day. Oh, quick question. What is the MSA? Middle superior alveolar. So we usually deliver anesthetic around the premolar area on the maxilla. So to cover the area where the PSA doesn't innervate. You can use this in conjunction with your posterior superior alveolar, the middle superior and then the MSA, which is our anterior superior alveolar, to get our anterior teeth. So in the UK, I know there's different injection patterns that different schools teach. I know when I was in Fortis, or as an instructor at Fortis, we would do the posterior superior to anesthetize the back molars, and then we'd also do an injection on the palate as well to help innervate the teeth, our premolars, anterior teeth, from the palatal approach. So do you use the palatal, the AMSA? Not so much. I'll get nervous about the calculations, the dosage. And in your clinic, are you a student or are you a practicing clinician? A student, yeah. And in your anesthesia course, do you calculate the dosage for every patient? Or I know with certain, you're going to start delivering those semester. I'm a third year student. Yes, so definitely you would have to calculate the dosage if you work in a pedo office. So I know in Arizona, and different experiences that I've had with pedo, that's something that you definitely have to consider the dosage when you're dealing with a smaller body type, so typically a child. So in pedo offices, if you're working there, a lot of times the hygienist does do a lot of the anesthesia for the doctor. So yeah, you'd have to do the calculations as well. And then in private practice, looking at the medical history and realizing if the patient needs the cardiac dose. And I think that that's a little bit easier, right? We know that that's 2 cartridges typically of Lido. But yeah, even I have to go back and use my resources. So usually when I'm practicing, I bring some material with me. The same thing with nitrous. Nitrous is something that I don't use all the time. So in the times that I do use nitrous, I typically have to refer back to different handles that I've gotten in the past, whether it be at school or different CEs, to help me with the dosage with tidal volume and as well. So that's something I'd really recommend as you start practicing. Maybe make yourself a little handy chairside guide that you can return to look at the calculations and different formulas, whether it be for anesthetic, for outside of like outside of school, yeah, like a notebook, like a binder or something that is really quick and handy. But you're right, I don't always remember the exact formula to calculate the dosage. Usually I have to look back and look at my material too. Okay, I'm going to go ahead and stop the video now. Thank you so much, Amanda.